Today, we're talking about a powerful, gentle approach to therapy, person-centered therapy. What is it? Where did it come from? What does it aim to do? And how is it different from other therapies like CBT or RCT? Let's dive in. What is person-centered therapy? It is sometimes called client-centered or Rogerian therapy. It was developed by the psychologist Carl Rogers in the 1940s and 1950s. The core belief behind it is that every person has the innate capacity for self-understanding, growth, and healing. Rather than seeing the individual as broken or needing fixing, person-centered assumes that given the right conditions, people can move toward their ideal self, or what Rogers called self-actualization. In short, person-centered trusts you. You are the expert of your own life. The therapist isn't someone who fixes you. They create a safe, supportive space for you to explore and reflect and grow. Person-centered is non-directive. This means that therapists don't lead, interpret, or instruct. Instead, the client leads. They talk about what matters to them, and the therapist offers their empathic presence. The effectiveness comes not from specific techniques or interventions, but from the therapeutic relationship itself, the quality of the connection between therapist and client. According to Rogers, there are several core conditions that a therapeutic environment must provide for real change. First is congruence or genuineness. The therapist needs to be real, transparent, and authentic, not hiding behind a professional mask. Second is unconditional positive regard. Therapists accept and value the client without judgment, fully honoring their feelings and experiences. Third is empathic understanding. The therapist deeply strives to understand the client's inner world, their emotions, their struggles, their perspective, and communicates that understanding to the client. When these conditions exist over a period of time, person-centered holds that clients can naturally move towards self-awareness, self-acceptance, and personal growth. What person-centered therapy aims to achieve and who it's for. The goal isn't just to solve a problem, but to help the person become more integrated, more authentic, more aligned with their true self. As one summary puts it, the individual and not the problem is the focus. Benefits often include greater self-awareness and self-acceptance, improved self-esteem, emotional healing, and healthier relationships. It can be particularly helpful for people who feel disconnected from themselves or struggle with their self-worth, or want to explore feelings and emotions in a non-judgmental space. Because it's non-directive, people who prefer to lead their own therapy or don't respond well to highly structured or directive approaches, this can be a really good fit. How does person-centered differ from other therapies? In therapies like cognitive behavioral therapy, CBT, or rational emotive therapy, RET, the therapist often interprets, challenges thought patterns, assigns homework, or gives structured interventions. By contrast, person-centered, the therapist does not direct. They trust the client's inner capacity to find their own way. Person-centered emphasizes the therapeutic relationship, trust, empathy, acceptance as the main treatment tool. The client's growth arises from that connection and self-exploration, not from a particular technique. Where CBT might target specific symptoms, thoughts, or behaviors, person-centered more broadly aims for personal growth, self-understanding, authenticity, and long-term inner change. That's not necessarily better or worse, just different. Some people benefit from structured techniques, others benefit from space to explore. There are some limitations and people who it might not work best for. Because person-centered is non-directive, it may feel too open or unstructured for people who want concrete strategies, guidance, or coping skills. It relies heavily on the quality of the therapist-client relationship, as you can probably tell. If empathy, genuineness, and acceptance are not present, the foundation for growth may not hold. It may also be a therapy that takes a little longer to see some progress. Change depends on that internal self-exploration and is self-driven rather than external interventions. When might you consider person-centered therapy? You might consider it if you are feeling stuck, disconnected, or unclear about who you are. Maybe you're struggling with self-esteem or identity. You might benefit from it if you're feeling overwhelmed by structured therapies or feel like you haven't been heard in more directive therapy. If you're looking for a safe space to explore your feelings, make sense of experiences, and reconnect with your authentic self, it could be a great option. As well as if you're open to self-exploration and willing to lead the work of within therapy. If any of these things are true, person-centered therapy might be a good fit for you. That's a quick look at person-centered therapy, its roots, what makes it unique, and why it can be deeply healing and transformative. If you've tried person-centered or are curious to learn more about it, I'd love to hear your thoughts or experiences in the comments. And if you found this video helpful, consider liking, subscribing, and sharing so more people can learn about therapeutic approaches. Thank you so much for watching. Take care of yourself, and I'll see you in the next video.